when you're faced with the fact that that's coming for all of us, and all of us have that realization at some point, but when you're faced with it, I think it's a unique experience or a unique chance to redirect a bit and just place importance and priority on where you spend your energies.
This is Andrew Vance, and you're listening to Choose the Hard Way, where my guests share stories about how doing hard things builds stronger, more resilient people. If you enjoy this episode, please give it a 5-star rating wherever you listen, subscribe, and forward it to a friend who likes doing hard things. If you want to suggest a guest or be in touch, you can reach me at choosethehardway@gmail.com or at hardwaypod on Twitter or Instagram. Dr. Kevin Sprouse is trained and certified in both sports and emergency medicine. He serves as the head of medicine for Education-EasyPost Cycling. Dr. Sprouse's private practice is Podium Sports Medicine, where he works with elite and professional athletes across numerous sports and disciplines, including pro cycling, triathlon, PGA golfers, NFL and MLB players, Olympic track and field athletes, and many more. The focus of Dr. Sprouse's academic interests and practice has been the care of the high-performance athlete, as well as how exercise, diet, and recovery affect the health and well-being of all active individuals at any level. I've always greatly benefited from dialoguing with Dr. Sprouse about these topics, and I'm excited to be able to share this conversation with you. We discuss recovery, training, the future of performance, and the patterns and habits you can apply to your own life that Dr. Sprouse has observed among the elite professional athletes who have entrusted him with their health and performance. Dr. Sprouse is also the host of the Podium podcast, where he dissects the principles of performance. It's a great listen, and if you enjoy the hard way, you'll want to check it out. Go to podiumsportsmed.com to learn more about Dr. Sprouse and look for his podcast, The Podium, everywhere you listen. You can find those links in the show notes.
I don't do very much. Well, I can't say I do really much of anything in mixed martial arts, except there's one guy I've kind of consulted with a little bit through the years, a local guy. But it's like a wide swath of athletes that I work with, but I started very focused. So when I came out of school or out of training in sports medicine, it was cycling. I went straight into cycling. I worked with cyclists. That was pretty much it. And then it kind of branched out into triathlon, running, track and field, worked with some baseball players. Like it just started kind of spreading out. And now it's kind of that full gamut from golf to endurance sports.
So Kevin, you trained in emergency medicine and in sports medicine. How did your practice gravitate towards where you are now, and how do you describe what it is that you do today?
I trained in both. I finished medical school, did a residency in emergency medicine in New York City. And while I was doing that training, I got very much into cycling. I was previously into triathlon prior to med school, got really out of shape in medical school, just had my face in a book the whole time. And to the point where I think I put on 40 plus pounds. I mean, it was ugly. And at one point there were a couple professors there at the med school who came to a small group of us and said, "Hey, you guys used to be active. You're not now. Like, we're putting together a bike group. Like, we're going mountain biking." We were in Blacksburg, Virginia, which is a gorgeous place, great road riding, mountain biking. And so we just started getting back on the bike. And so in med school, I redeveloped this love of endurance sports and really just being outside. And then in residency, doing emergency medicine, residency is an interesting time in a doctor's life where you're just kind of worked to the extremes. I mean, it's days and nights and weekends and holidays, and you're home. You walk home, grab a quick meal and 6 hours sleep, and you're back at the hospital. And you do this for years. And I honestly just got really down on the whole emergency medicine thing. Like it was just wearing me out. And one night, I guess it was my second year of a 3-year residency. Just had a really taxing night, both from a workload and emotionally. Came home, was watching the Tour de France, and they interviewed this guy who was the head doctor for, at the time, I think the team was called Garmin Transitions, the same team I work for now. But it was, they interviewed him. He was an ER doctor, kind of talked about his path. And it just kind of hit me. I was like, crap, I had no idea this was a career path. Like, I could do this. So from there, I started looking at what it would take to get into sports medicine as well, which is a fellowship or a subspecialty training program afterwards. And really just started down that path with the thought that, hey, I've got a degree in exercise science. I loved the human performance part. That doesn't really exist in medicine, but here's a way that I can maybe bring the two together, and just started moving that way. Ended up meeting that doctor that I saw on TV. He was interviewed on NBC, or I guess it was, I can't remember what the channel was that used to show it, Versus or whatever Versus. They were called. OLN.
Yeah.
And so I ended up meeting Prentice Stephan, who became like a real mentor of mine. I mean, to this day, we talk every few months, but if I've got a problem I just can't crack, I'll call Prentice. So that's how I got into sport. And then when I was fashioning my practice, I did end up going to a sports medicine fellowship, doing that subspecialty training. And then when I was fashioning my practice, I really wanted to bring a team doctor service to people who don't have it. So what I saw in working with NCAA athletes, we worked with the Red Sox minor league organization, even working in cycling. At a certain point, athletes have this structure of support around them, medically, performance, nutrition, all this stuff. And then you get outside of that, maybe even professionally outside of that, but certainly high level recreational, and you have no such support. You've got to assemble your own team if you even have a team. And so my thought was that it would be really interesting to put together a practice where people basically join like a membership model, call it concierge medicine, but I don't love that term. But that gets the point across to a lot of people, so that they join up, and then we've got a set of services and support that we offer to them the same way I do to my pro athletes. And so we've got a very small patient population, but we treat them. I won't say we treat them like pro athletes, but we treat them directionally that way with respect to their goals for health and performance. So it's been a lot of fun for me.
So are some of the ways in which you don't treat them like professional athletes, for example, you don't make them sleep in a twin bed and share a room with another person in like a Motel 6 when they travel?
Exactly. Yeah.
Right.
Yeah, they don't have to eat, dried out chicken and white pasta before going up to a room that is really only meant for one person and sharing it with two.
Yeah, fantastic. So I just wanted to jump back and dig into a couple of things that you shared there, Kevin. First of all, when you entered medical school, it sounds like you already had an interest in endurance sports. As you mentioned, you pulled on the arm warmers and the crop top as a triathlete a few times, it sounds like. What did it feel like when you had put on 40 pounds? It sounds like that was probably a sacrifice that you had to make because you were so focused on your studies. But what was your experience of that like? And, was that just one of the sacrifices you had to make to be the medical student you wanted to be?
I thought it was. I think in hindsight, it wasn't. It felt, it's insidious when you start to get overweight, right? You still, I'd still go to the gym occasionally. I'd still do this and that. And I was like, tricked myself into thinking, I'm still healthy. I'm still active. But if you were to look at, time 0 and time 18 months, the transition was massive. But if you looked at it week by week, it didn't feel like that big of a deal. And I did justify it by thinking, well, this is a season of life where I've got to buckle down, learn this stuff, be a good student, which is all true. But what I realized when I got back to being active is that I was much more efficient in my studies. I actually had better grades after I stopped studying so much and started being active. I still studied plenty, but the point was I was cultivating like a healthy body and a healthy mind. So the time I spent studying was much more fruitful. And that was a big revelation to me, and something that I've really kind of hung my hat on going forward. Not so much outwardly, but in working with patients, the cognitive benefits of being physically fit for the professional athlete, but also for the recreational athlete, the guy in the boardroom and the C-suite is really important, I think.
And your love for endurance sports carries forward today in your private practice and what you're doing with the team. And then what role does it play in your life as an individual, and what is your interest in endurance sports now?
I still love endurance sports. I've had kind of an interesting 3 years, probably more than that. So I just got hopefully over about with atrial fibrillation. And then, so we can talk a bit about that, but that sidelined me for a while. Prior to that, I've got kids that are 11, 10, and 5 today. He was 4 yesterday, so I've got to get that right.
Congratulations.
Thank you.
Happy birthday.
Exactly. Happy birthday, Ford. What I've had to learn in that regard is that you can't hold on too tightly to a training schedule as a parent. And it's kind of been freeing. Like I'm less inclined to really go a hard line on an event. So for instance, I signed up for SBT Gravel this year, had every intent of doing it, and just wasn't able to get the fitness. Wasn't able to find the time. I was still training and moving toward it, but I was a good bit below where I wanted to be 6 or 8 weeks out. And because of that, 5 years ago, I would have said, well, I'm just going to go hammer myself and do this thing. And now I sit back and say, okay, well, it's not happening this year. I'm not going to do something that's detrimental to my health. I'm going to keep training, but recognize that I'm not getting paid to go out there and do this. So I don't want to do something that's going to be, cause me an injury or something else. And that I think has come from my dealing with atrial fibrillation, where it was almost 2 years ago that I had the first episode. For people who don't know what AFib is, it's where the top chambers of the heart don't beat in a coordinated fashion with the bottom chambers. And so you get a very inefficient heartbeat. And even though I was quite fit, if I would walk up a flight of stairs, I'd have to stop about halfway up and catch my breath. And that was only the atrial fibrillation would come and go, but during an episode, just sidelined me. And for me, anytime I would get a high level of training, a high training load for a day or a couple of days in a row, then overnight I would tend to pop into AFib. And so I had a governor on, basically. I could go for walks, I could go for easy bike rides, occasionally go to the gym, but that was about it. So it taught me a lot about how much importance to put on those things. Like, I'm a huge fitness advocate, but at the same time, it's got to be balanced within the rest of life and not outsized.
And AFib is super common now among athletes with a long training history. It's something I've dealt with as well, which I know we've talked about offline. And how do you think about AFib, and what is it telling endurance athletes about how they're using their bodies, if anything?
Yeah, I think it is telling us something. And I think we're still learning what it's telling us. So anytime that I get into this conversation, which I think is a good one, I think it's incredibly important to point out that physical activity and, some high level of physical activity that imparts a high level of physical fitness is hugely important. And the risk of something like AFib should not keep anyone from exercising. In fact, for the vast majority of people, even the vast majority of endurance athletes, their exercise is protective against AFib, right? So I want that to be very clear. This isn't telling anybody, back off, find another sport, anything like that. But what we're starting to see is an association between high levels of endurance sport training, chronic high load, and an increased incidence of atrial fibrillation. That doesn't mean that it's one-to-one. It doesn't mean that it's even necessarily causative, but there's enough smoke there to look for the fire, right? And so then if you start talking to specialists in this, there are varying viewpoints that seem nuanced, but actually have some pretty significant implications with regard to cause and what we should do and what we shouldn't do. And so I say all that to just point out, we don't know exactly, but it would seem that as you get beyond a certain level of chronic training load, and I don't mean that like the CTL that you see on your training peaks, right? But like holding a high training load for a chronic amount of time, that there's some remodeling in the heart. There might be some fibrosis or scarring. And because of that, the electrical pathways get kind of short-circuited in some people, right? Still a low likelihood, but we're seeing it more and more. So I think what that's telling us is that we need to recognize that you can exercise too much, in my opinion. This is also a hotly debated topic, and it depends on your endpoint. I don't think you can exercise too much from a standpoint of protecting against heart attack and things like that, although there's some data in that regard too, but I think that's a weaker argument. But with respect to AFib, you can probably exercise too much, leading to some inflammation, scarring, electrical pathway problems. And it's also not just exercise. So for me, I look back and I say, okay, well, I actually didn't have a hugely high training load at any point. But if I was doing 12, 15 hours a week in residency when I was sleeping 4 hours a night, stressed all day, probably eating crap, probably drinking at night, on my off nights, that whole picture is a bad one, right? If you just isolate the exercise and say, oh, well, you were only training 12 to 15 hours a week, like that's not quite enough to really say this will cause AFib. I agree. But if you look at the big picture, it becomes problematic.
I think that you're highlighting a really interesting aspect of performance and stress management, both as it pertains to people who are not professional athletes as well as professional athletes, taking a look at the overall holistic picture of what are all of the stressors, what is that bigger picture of sleep, recovery, lifestyle factors, things going on outside of the domain of exercise, all of which are inputs into that stress equation. And I think that's part of what's really interesting about your practice, Kevin. And I'm wondering if you could perhaps talk a bit about how you approach the management of those factors with the athletes that you're working with outside of the World Tour. And then, of course, I'd like to get into what you're doing with pro athletes as well through your team doctor capacity. Yeah,
this is actually what came to mind first when you were asking about the, how do we treat the recreational athletes compared to the pro athletes? And aside from the hotel analogy, what came to mind was the fact that, especially for my recreational athletes, a lot of times I have to remind them, hey, you've been sleeping 5.5, 6 hours a night. You've got this big thing at work. You've got whatever else going on. Now's not the time to be, pegging your training, trying to peak in 3 weeks from now. Like something's got to give, right? And it doesn't mean you throw in the towel. Kind of like with my SBT gravel thing, it's not that I'm just never going to do this again. It's just that, hey, that's not what I do for a living. It's in my current hierarchy of priorities. It's not even the top three. You've got job and family and all these things that kind of throughout life kind of move to different positions. And so I think it's important to remind people, and also just to give them a bit of license to make that decision, to say, hey, I need you to sleep in the next few days, right? I don't want you up at 4 doing junk miles on the trainer or, going for a run that's really not going to do anything but break you down. I want you sleeping in. And then if you need a little activity to clear the head, a 30-minute jog at lunch, a walk, something like that is more in keeping with where you are in your overall stress load at the moment. We're not going to hold that forever because that's problematic long-term. right? But if you need a week like that, like I feel like it's my job to tell you to take it, right? And oftentimes people know that that's the case, but it's almost like they need someone who's got that broad view to tell them, hey, it's okay. And you're going to be stronger for it. So with the recreational athletes, there's a lot of that monitoring of all those aspects, and also pushing them at times and saying, hey, now's a great time for you to really make use of some of the free time and the low stress and whatever, like get after it. So it's both sides of the equation. What we do is utilize wearable technology like Whoop or a Ring. A lot of conversations with patients. We look at continuous glucose monitor data, and a number of things like that we have all feed into one dashboard. And then I can pull it up in the morning and see who's sleeping well, who's sleeping poorly, who's got a fever, who's not recovered, who is. And if there's a trend that, they're not recovering well, it appears their stress level is high, then reaching out to them and just saying, hey, what's going on? And that usually stimulates the conversation that gets us where we need to be.
And on the nutrition side of things, you mentioned continuous glucose monitoring. Are you also looking at inputs, or are you most concerned with the outputs you see from the CGM?
No, I'm more interested in inputs, quite honestly. So,
okay.
I work with Super Sapiens and use that we use it with our cyclists. It's not yet allowed in races, but we use it in training. And I use it with my patients. And Super Sapiens is a platform that connects to an Abbott biosensor that is worn on the back of the arm. And the output, like you mentioned, is blood glucose level, minute by minute. So it's a really interesting output, but it's meaningless to me unless we know what caused it to go where it went, right? And so in that case, nutrition is important, stress is important, sleep is important. All these inputs drive glucose metabolism. I had a meeting with a patient yesterday who was new to wearing one of these, and he had just kind of written down what he noticed was impacting his glucose. And it was, he had done lead boat, so he had altitude on there. But he had noticed that lack of sleep and stress. He had a stressful conference call at work. And he's like, I was pegged in the 120s on my glucose the whole time, and all I'd had is a salad beforehand. And it was a very common thing that I've seen in myself wearing them and others, that if you were just focused on the glucose level, you'd say, you ate too many carbs. And you're like, no, I had a salad. It's like, well, I don't know what happened. But then you dissect it a bit and you're like, oh, you were really stressed. It was this big cortisol dump. Because of that, your body is liberating stored glycogen in a fight or flight mode. It makes total sense. And so, yes, to your point, the inputs are so important. And it's a reason why we can look at glucose monitors to kind of infer what somebody's stress might be.
Nutrition, endlessly fascinating topic. And I think this is one of those crossover points between what we see happening with professional athletes, particularly in the endurance domain, particularly with professional cycling, and with what amateurs are doing. So whether it's SBT, gravel, Leadville, the Tour de France, whatever the case may be, what you hear so much about right now is professional athletes training themselves to be able to synthesize 120 grams of carbohydrate per hour or higher, and that maximizing their performance. You don't hear so much about ketones, exogenous ketones anymore, but you definitely hear about them somewhat. And then I'm just curious, is that something that amateurs should actually be trying to model? And then how does that balance with health?
Yeah. So I think those things are something that amateurs should model to a degree, and maybe full on. But I'm a big proponent that a lot of what we learn in working with professional athletes, kind of at the pointy end of performance, applies readily to the rest of us, even those of us that aren't very active. So if you look at someone who's pretty sedentary, we can, if you talk them into doing a lactate test or even a fasting or resting lactate, you can gather a lot of information about their underlying physiology and kind of malfunctioning physiology from those tests. So I kind of position everything I do as pulling from the most elite and then bringing that information to the rest of us, interpreting it in a way that makes sense for what that person is doing. So if we look at those two scenarios or examples, carbohydrate intake and ketones, I think both are worth looking at. So we see that the pros tend to do better with this high carbohydrate intake, training their gut, getting intake up to around 120 grams an hour. And for somebody who's going to do an event like an Ironman or, Leadville or something like that, I think it's worth seeing how much you can approach that. So if you were to come to us and say, hey, I'm doing Leadville in a year, right? One of the things that we would do with you is start out and get an idea of how much your intake is now. And if you're around 60, 65 grams an hour, I'm not going to tell you to go to 120, but I'm going to say, hey, let's see how 80 feels. Let's see how 90 feels, right? And kind of train that, work on it, and move toward that goal of 100 to 120, right? You may reach a point where you take in 100 and it just goes terribly wrong. And you back off, you train a bit more, you try 100 again, it goes terribly wrong. That's fine. If we get you from 60 to 90, that's a huge improvement over your available fuel. So that still informed us that 60 was perhaps too low, or at least looking at working that up. But it doesn't mean we need to aim for the same heights, so to speak.
What do we understand about the relationship between the nutrition that people are taking in during athletic activity and the gut biome? And I guess maybe the underlying question here is, taking in that much concentrated carbohydrate, do we understand whether that has deleterious impacts on the gut biome? And if so, what can we do to mitigate that?
That's a really good question. And I don't think we fully know the answer yet, partially because we can't measure the gut biome very well. There's a lot of tests out there, but most of them are pretty poor. And the ones that stand out a bit are still somewhat of a proxy for what's going on inside. So it's not much of a direct measure. But all that to say, there's reason to suspect that it's probably not the best thing for the microbiome. But I think you can mitigate that to a large degree with a diet outside of racing and training that is high in, prebiotics and probiotics. So high in fiber, high in, those things that are harder to digest, that your body has a hard time digesting, that requires the bacteria in your gut to digest it for you and kind of gives them food. And then maybe taking a probiotic at times. I don't think it's something you need to be on all the time, but there may be a rationale for taking it during high levels of training or heavy training blocks. The other thing to consider, I think, is the question of whether having a blood glucose of 140 or 160 for hours while you train or race, is that healthy? And that's a valid question that's come up a lot now that people are wearing glucose monitors and seeing these numbers. You may aim for that as a fueling target because it probably helps performance. But then is there a problem with having your blood glucose that high? I actually think there's not, because during exercise, your body uses a different transporter. So if you're sedentary and your blood sugar is really high, you're pumping out a bunch of insulin to manage it, right? And that insulin is pro-inflammatory and has problems downstream at various organs, vessels and whatnot. But when you're exercising and you have a high blood sugar like that, your body uses a different mechanism to get it into the muscles that is insulin independent. So you're not secreting a bunch of insulin. And that blood sugar is being burned as fuel, pushed into muscles, and probably much less detrimental.
To shift gears for a moment here, Kevin, let's talk about your role as a team doctor. As you mentioned, you've been doing this for a while. I think you said you've been a team doctor for 13 years. Is that correct?
That's correct, yeah.
Yeah, and you mentioned the name Prentice Stephan. I was in touch with Prentice. I wrote a story for Outside about Craig Lewis in the early days of Jonathan Vaughters' starting his team. I don't remember if that's when I came into contact with him, but I remember really enjoying the conversation.
Yeah.
So how did you get into this space, and what were your aspirations? And let's just talk a little bit about, what does a team doctor do?
Yeah. So, I mean, I got into it by literally by watching that interview of the Tour de France, going to the team website, finding his email, I think, and just sending him an email and saying, hey, I know this is out of left field, but I would love the chance to talk to you, to pick your brain one day and just kind of see what's going on. And he wrote back almost immediately and said, hey, actually, I just landed at the airport. He was living in Napa at the time, landed in San Francisco. He was like, if you catch me in the next hour, I'm happy to chat. And so we talked while he drove home, and then I flew to a conference that he helped put on, and we met that way. And it was really a lot of serendipity, just kind of throwing my name out there. Of course, I had a background in exercise science, medicine, whatever. Like, the boxes were ticked, but there was some luck there too, for sure. And then, he basically taught me how to be a team doc. I mean, we've got 5 team doctors that work for our team, and it's typically either 4 or 5, depending on the season. And it's a combination of overseeing some aspects of rider health from a distance. So your blood work, we have some standard or regular blood work we have to do with them per UCI guidelines. And then we'll do some extra in the team when it's necessary. So overseeing that, filing that paperwork with the UCI, kind of the administrative part of it. But what's more, I think, interesting and fun is the day-to-day on the ground at a race. So there it's much more being available and present. And so, being around when they have breakfast, chatting with them on the bus, just kind of always being there so that we're having one conversation and then another one arises, oh, by the way, doc, I've been meaning to ask you, or I've had this concern, and then we can get into it. And that's the part I really like. It's just the interpersonal aspect of it, getting to know them well enough that they then, come to you when they've got a question about whatever it is that's going on, medical, performance, whatever, or medical for their family. That comes up a lot.
And who are the other experts that you're working with there's the medical aspect of it, but what is the array of people involved in performance management and care for athletes on a team at that level?
Yeah. So on our team, we've got, like I said, we've got 5 doctors. We've got 3 chiropractors, a couple of physios, which is like a physical therapist in the US. We've got a nutritionist. We've got trainers who are the ones who write the training programs. And then we've got our directors who are the ones who kind of run the show. I mean, they're the managers at the race. And then there's a head director, Charlie Wigalius, who is kind of in charge of all the staffing of races and who does which race, and keeping track of overall performance of the team. And then another director, Andreas Clear, who is tasked with overseeing all the material. So he's the one making sure our riders have the best wheels and the best bikes, and everything's kitted out just perfectly. And so all of us, and then there's Jonathan Vaughters, who kind of oversees the whole thing. And so all of us kind of form the performance group, and we'll meet regularly throughout the year to tackle different projects, whether it's camps, altitude camps, cooling protocols, whatever it is we're working on at the time, and just general performance as well.
How did sports psychology fit into the performance picture?
Yeah, it's huge. We have in past years had sports psychologists on the team or direct relationship with a sports psychologist. It doesn't, I think it's a massive part of what we need to offer the riders. But it doesn't work great to have somebody who's employed by the team, because one, you've got to find somebody who works well with you just interpersonally as an athlete. And you can go to the greatest sports psychologist in the world, but if you guys just don't hit it off, it's not going to be a good relationship. And two, if they are employed by the team, sometimes there's the sense that maybe they're feeding information back to the team on a performance standpoint. Like, don't send him to this race because his head's just, he's really struggling with whatever. That's never happened, but there's always that question. And so the way we tend to address it is the trainers and the medical staff identify when somebody could really benefit from having that type of resource. And then somebody will approach them, one of us will approach the athlete and just kind of broach the topic, see how willing they are. And then typically they're, pretty willing and understanding of why it's beneficial. And then we'll help them find the resource that is going to be good for them.
Professional athletes, in particular, pro cyclists, for fans of the sport, we know that these athletes are putting themselves in really dangerous situations pretty frequently, from a road furniture point of view, course point of view, and then just natural parts of the sport like sprinting, descending. There's a high probability someone might get injured. And riders themselves, being world-class athletes, highly motivated, sometimes might want to continue. I'm thinking particularly from a concussion or a head injury point of view. We've seen it so many times where a rider hits the deck, they appear to be visibly concussed, and they want to get back on the bike and continue. And also, it's highly beneficial to the team. The rider wants to do as well as possible. They want to show that they're tough for the prospects of their future career. A lot of incentives and motivations to balance there. How do you approach that as a doctor?
Well, the concussion one is uniquely difficult because there's oftentimes no visible injury. If a guy breaks his collarbone and you can see through the Lycra that it's like this, it's not a hard sell to say, okay, come on back to the car. Like, we got to get this taken care of. For a concussion, they can look fine, a little scrape and scrape on the helmet, but they can look physically fit to get on the bike. And so, unfortunately, in cycling, you do have the instances where you see the rider who is very obviously concussed, or at least concerning for a concussion, get back on the bike and ride off because the camera's there before anybody who has the power, so to speak, to pull them off the bike gets there. Fortunately, that doesn't happen as much anymore as it did. There was a spate of instances 8-10 years ago. But we're getting better at recognizing that as a sport, I think. But what we do within our team is everybody who's going to be in the car, so mechanics, directors, doctors, obviously, and even the other riders a little bit, or to a certain degree, we give them a bit of training on what to look for, right? And then we empower them to say, hey, if you're the mechanic and you're handing a guy a bike and there's not a doctor in the car or whatever, and it doesn't seem right, like if you're worried about it, you have every right to say, man, you're done, or you need to talk to the race doc, or so we've gotten to where we take it very seriously. The directors are great at giving us, they understand that there is the chance that maybe we pull somebody out who's not concussed because we're worried, and then their race is over, but it's for their health. That hasn't happened, and that's not a high likelihood, but we've all kind of agreed that the rider's health is far more important than any of our performance goals for the day or the week or the month. So within our team, it's easier, I think, to navigate that because we've created an environment where that's the priority. But the sport is difficult just inherently. In soccer or football, you pull somebody to the side, you pull them out of the game for a little while and you assess them, you see how they do, and you send them back in or not. For us, if you stand with them for more than 30 seconds to a minute, the race is gone. And you might as well pull them out. And so we've gotten to where if I come up to a rider who's on the ground and they're getting back on the bike, the mechanic's handing them a bike, I'll ask them a few things. I'll look at their helmet. But it's really basic. Hey, are you okay? What happened? Right. And if they can describe going down and all that stuff and how they hit, I can be pretty sure they didn't lose consciousness. And a couple quick questions like, you know what race it is? Do you know what stage it is? Who's in the yellow jersey? And if they answer those, as they're getting back on the bike, they're kind of off, right? And that's fine. And then we can pull up next to them because they're going to be off the back. They're going to be in the cars and whatever. And if there's a concern, one, I can watch them ride solo where they're not going to take anybody else out. And that's a balance test, which is kind of one of the best things you can look at for a concussion. Not that in a cyclist that's solely diagnostic, but it's great to see if their balance is good. And then I can pull up and ask them more questions, right? So there's still time that they're trying to get back to the peloton. And we can utilize that time as our sideline time. Now, they're still moving, they're still active. It's not ideal. We haven't set them aside to talk to them. But within the confines of how they compete, it's still something we can do reasonably well.
And from a COVID protocol point of view, some things that seem pretty interesting happened during the tour this year. It seems the same thing may have happened during the Vuelta, but during the tour, there was that transfer flight after the first few stages. And I don't know all the details, but from the outside, it seemed like the organizers put most of the riders from different teams on one or two planes. And it just seemed like a really risky thing. I had a difficult time understanding why anyone would do that other than financially it made the most sense. We talked about it a lot on Beyond the Peloton, another podcast where I'm a frequent guest host. But do you have any thoughts on that as a team doctor?
I don't know the reason why they did that. My guess would be that one, the expense and logistics are hugely important to the race organizers, and understandably so. The other thing is there's the presumption that at that point they're within a bubble and they've been tested. They are undergoing, they had PCR testing coming in, some antigen testing regularly through the tour. It was kind of left to the teams, which is a little odd. But there was presumably some ongoing testing. And so you're a little bit safer in that regard. But I think the combination of the two, kind of like, hey, we've given you a protocol to try to stay as safe as possible. We've gotten you into this bubble, so to speak. And there's really no other way that we can feasibly, financially, and logistically get you all to where you need to go. It's just kind of the only way to do it. That'd be my guess, at least.
Yeah, it was an interesting one from the outside.
Yeah. And there's been, over the last 2 years, there's been a number of times where as team doctors, we kind of scratch our heads at what's going on. The entire team and peloton can be in a bubble, and then that the race organizer is set up, and then you go down to dinner at the hotel and it's with all these tourists at a buffet, right? And that's what they've arranged for. And it's like, come on, this doesn't make any sense. And so there was definitely times early on where things like that were happening more often, and we were having to troubleshoot in the moment and say, okay, riders, go back to your rooms. We're going to figure out if we can get food delivered or what. So cycling it's a difficult sport logistically. It's such a moving beast day to day with all the people in the organization on top of, commissaires, riders, team staff. And they're constantly moving, and you've got to go, like, the riders can be pretty insulated, but the staff has to go shopping. They have to go get gas in the cars. They've got to, there's all this interaction outside of any proposed bubble that it can't really be insulated the way like the NBA was. Right. And so to some degree, some of it was done really well. And some of it, you just couldn't reasonably stick to a really strict protocol and pull off the sport. I'm not saying that was the way to go. I don't know what the right answer is, but it's just a recognition that it was hard times in cycling.
And Kevin, I know this isn't happening on EF Education-EasyPost, but just globally in the sport of cycling the past couple of years, a trend that has emerged is we've seen people who are very successful, particularly Grand Tour riders like Tom Dumoulin, now Jonas Vingegaard, struggling with mental health challenges, and we're seeing more riders exit the sport early. Is there anything that fans don't understand about the lifestyle or the pressure that these athletes are under, and ways in which, I mean, we are seeing it across all sports. We're seeing it in entertainment as well. But do you have any observations about this trend?
Yeah, I do think that it is not unique to cycling. I would guess that within cycling, the prevalence of this is very similar to sports like tennis, where I think a lot of the same challenges are shared. The travel is, I mean, these guys are on the road constantly, and it's not an easy life by any means. So when they're home, they're training extensively. They're probably often tired when they're around their family, right? They don't get to be kind of the best versions of themselves a lot of times. And we've all experienced that. But if that was your experience every time you're around your family, is that you were in a big training block at home, that'd be tough. And then you leave, you're on the road, interaction with your, wife and kids, if you have them, or other significant others, or parents, or whatever, is by FaceTime, right? Like you get a quick call every now and then, and you see how much fun everybody's having doing this. And then you're kind of living like a monk. I mean, I don't want to say it's a bad life. You've got a chef, you've got a massage therapist, you've got people taking care of you. But it's challenging. I mean, even I typically spend anywhere from 50 to 80 days a year on the road, and I come home just wiped out. And I haven't been riding my bike. I've just been doing the travel and all that stuff. So it's really taxing. And I think it's often romanticized, understandably so. Like anything, you look at it from the outside and you see all the great parts, but you don't see the challenges. And it really is a challenging way to spend what is now 10 months out of the year. So I can understand it from that regard. And then the pressure that comes from it. So you talk about specifically guys that win Grand Tours or big events. It's kind of thought of that once that happens, that they're just going to keep doing it, right? That they're going to win 4, 5, 6 Giros, Tours, whatever. And really, historically, that's the exception to the rule. I mean, you have those guys who do that, but the reason that we can all name them off is that it doesn't happen that often. So even the ones that win a Grand Tour, maybe they win another Grand Tour, maybe they win a few 1-week stage races, and that's still an amazing career. But the expectation is that they'll do so much more than that. So it's almost like an unmeetable expectation. And that, I think, is not unique to cycling. That's what you see in tennis and gymnastics, right? Where you have someone go to the Olympics and just expect that they're going to win the gold medal in every event they enter. And if they don't, it's somehow a failure. So it's so multifaceted. There are some reasonable arguments, I think, against what I just said, and and for kind of a mental toughness approach too, and kind of nurturing a little more resilience in athletes. I'm not saying that's right. I'm saying there's probably some truth in all sides to this, and finding out what works best for an athlete is really important. The problem being the tendency in some settings is more likely to squeeze everything you can get out of the athlete, and there's 10 more waiting for their spot. You move on. And that I think is really reprehensible, quite honestly.
And when you're when you're on the road 50 to 80 days a year, how are you balancing the challenges and complexities that introduces for you? Like, you're a family man, you've got kids, you have a partner, you have a private practice. Like, how do you balance all those things?
It's tough. I mean, my kids have never known anything different than dad works half his time in Europe, and my wife pretty much the same. She's been a part of my whole career, obviously. The good thing is, what I think is good is working in cycling. I've been able to take them on a lot of trips. So not every race I go to, but we'll go and set up in Spain or Belgium for, weeks or even months on end, where I can go from there and cover races. And then they get, pretty cool experience that I get to easily pop back into. And those times have been really nice, really enjoyable, and take a lot of that stress away because we're all in the same time zone. Things are just a little bit easier than being stretched apart. However, you mentioned having a practice, as my practice grew initially, that became much harder and harder to do. The nice thing is I've got a really small practice. So we cap my patient load at 30 patients. So I only work with 30 patients. And not all of them, well, the vast majority of them are not here in Tennessee. So I travel to them either at events they're doing or at their home, see them, and then do a lot of telemedical consultation or phone calls. It doesn't have to be that fancy. And so that aspect can continue when I'm traveling. Not so much during the race because the race is fairly all encompassing, but I'll tell my patients, hey, I'm on a race this week. Like if it's an emergency, you have access to me, no problem. But if it's something that can wait, we'll get on it next week. And everybody's understanding of that so far.
When you look at both the professional athletes that you work with and people in your private practice, the individuals who are able to consistently access the highest levels of performance, do you see any commonalities among patterns that lead to those performances? Are they doing anything similar, or do they have any innate qualities that are different?
I think the one thing that I will point out to patients in this regard is the ones that I see who are most consistently successful and high performing at whatever it is they want to do, right? However you define that. But when they have a goal, I guess that's the first part, is they know what they want to do. They know what they want to accomplish. And then they have a regimen around that. So a lot of times you get to a place where you're pretty successful. And with that comes both the right and the burden of being able to make your own schedule, right? To have control over your day, call it autonomy, right? And when given that, a lot of people falter. Things get pushed off, or they're not quite sure when to do things. And so implementing their own structure and regimen tends to be the thing that keeps people on track and performing best. And it seems simple, but I mean, I've seen it in myself where I've got control over my schedule and it's an off week, kind of an easy week for whatever reason. Things will just kind of fall apart. And you're like, well, wait a minute. I thought I had all this free time this week. And it's really developing that skill and that habit of regimenting things, sticking to a schedule, knowing why you're doing what, why you're not doing some other things, and staying the course. And to me, I think that's probably first and foremost for high performance.
To take that example of an easy week or a week off, when you consider yourself in your own performance, as you've analyzed that, why do you think that happens?
There is a law that I'm going to totally butcher. I was not a business student, and anybody who studied business probably knows this, but there's somebody's law that says the amount of work you have to do expands to fill the amount of time you have to do it in. And that tends to be the case. If we've got one thing to do that's going to last about an hour, right? You got one chore for the day. And you've got 3 hours to do it, and you sit down to do it, you probably won't finish until about 2.5 or 3 hours in, because you get distracted and you do this and that, and you've got time to be distracted. And so it's just kind of filled that space. But if you say, okay, this is going to take an hour, I've got this hour to do it. And at the end of the hour, I'm meeting so-and-so for a ride, or I'm going to the gym, or then it happens, right? And so by definition, then you also don't have the free time. But what you've really done is just allocated your free time, right? You've taken that autonomy over that time and exercised it, as opposed to just leaving it open. And I'm even a fan of saying this is going to be open. Like, I'm going to finish at this time, right? No phones, no whatever. I've got this hour to do the chore. And at that point, it's going to be free, but I'll figure it out at that point. But this doesn't bleed into that, right? And so I think it's that law. I'll have to look up what that law is called, but I think that's basically the crux of it for us.
And when you think about what's next in pro cycling, what's next in your private practice, what's next on the horizon of human performance, what are some of the things that professional athletes are doing today that we might see recreational athletes doing in the future? Or is all of that information so democratized now that there's not a difference?
I think it's much more democratized, and there's much less lag between what the pros are doing and what's available elsewhere. A lot of that's due to the fact that what they use now tends to be commercialized. So, at the Tour de France, we started using a device called a Cool Mitt, actually a little before the Tour de France, for core body cooling. And it was we'd used it years ago in a different iteration. It wasn't that good or easy to use. And now they've kind of tightened it up, and they've got this great new way of applying this technology. And so, we used it at the Tour de France, but very quickly I was seeing emails for, hey, this is being used at the Tour, you need to buy this. And so it filters down really quickly in that regard. What I think is maybe less immediately sexy, but something that is kind of more all-encompassing is the focus on longevity of career and longevity of performance that you see across sports right now, with LeBron signing another contract and athletes just having these careers that just continue at high levels of performance. I think that is a trend that we're going to continue to see. And the things that feed that are going to be what all of us want to get our hands on. And by that, I don't mean the devices you can buy, right? Because that's not what does it. It's the focus on recovery. It's the focus on sleep. It's the appropriate nutrition coaching. It's all those things that 10 or 15 years ago were totally ignored that are now cornerstones of performance day to day, but also extend that performance. So I really think that's where this space is going, both from my practice and with professional athletes.
And for pros and recreational athletes alike, with everyone that you've worked with, do people who do well tend to have similar methods of getting in state and having an optimal level of arousal when they enter competition, or is it all over the map?
It's all over the map. And I think that's one thing that maybe the general public doesn't understand as much. As a fan, you watch and then you hear a podcast or an interview with somebody who works with, some athlete. And this is the meditation they do or whatever. And you think, oh, this is how you do it. But then you talk to somebody else and it's, they love having a burrito ahead of time and listening to a certain song, and like that does it for them. So it's really variable, but I think seeing what numerous people do and taking kind of the broad strokes from that and applying it is really important. So then you can try things that, for instance, I work with one PGA golfer who had spent so many years working on just being calm, kind of settling things down, being able to get the stress out, that he got to a point where he was meeting with a new sports psychologist. He's like, we've actually got to get you fired up. Like, you've kind of lost that edge and that burn. So it's because you've worked so hard to just be calm when it came time to perform, which is important, but it had gone too far. So I think there's a lot of situational and individual aspect to it that has to be recognized. And the good thing is the area of mental performance coaching, which is kind of a spin-off of sports psychology, that area is really growing, and having more of those professionals to go to and employ as a coach to help with that process, I think is really important, and something we're going to see in the coming years.
If a random person were to come on the team bus at the Tour de France before a critical mountain stage, say, would all of the athletes be in kind of various levels of stress or worry or relaxation, or is it all about the same?
It kind of depends on who's there. So, like who the leader is. If Rigo is there, there's probably music blasting, people kind of dancing up and down the aisles, no shirt on, just kind of having fun. It's really variable. But for the most part, I'd say our team, like the way it works is as we arrive to the start town, the directors have all the riders sit down, go through the race briefing. There's a TV. They look at the parkour and where different things are going to happen. And that's very focused, slightly stressful. Not like nobody's getting yelled at or anything like that, but it's just like game on, right? But then there's another hour or so after that to when the race starts. And there's much more decompressing going on at that time. There's always music. There's jokes being told. And like, it's pretty light. So they take the time to focus and then back off. They know what they need to know, relax a bit, go do the race.
What's a day like that like for you?
For me, at a day like the tour, I get up pretty early and usually go for a run. Not every day, but most days I'll get out, go for a run just so I can have some activity. Come back, I'm there for breakfast. I'm there kind of as we load up the bus. I'll usually ride on the bus to the start with the riders just to be accessible again. You know, it's a good time for a conversation if they need to ask me something. And then oftentimes I'll sit in on that meeting and just kind of hear what the strategy is for the day, what they're trying to accomplish. And then kind of step off the bus, let them do their things, be outside, be available. And then I'm in the front seat of the car for the 4.5 to 6 hours of the race. Back on the team bus, back to the hotel, dinner, late night, do it again the next day.
What's it like when you're riding in the car? Is that fun or boring?
It's both. There's a lot of boring, but the director is usually driving. Well, there's always a director driving, and all of our directors are great. I really enjoy them just on a friendship basis. And so we have some good conversations. We'll listen to some music. We'll kill the time. But a lot of a bike race is, once the brake goes, if we're not in it, it's kind of boring, up until the point that the brake is caught and the race is on. So there's a few hours where it's a lot of dead time. We eat lunch and we chat. And it's nothing special. The views can be amazing. If you're in car 1 or 2, then you get to see some of the race. But if you're much farther back than that, you're just seeing cars. So there's a lot of boredom, but a lot of really unique experiences too. I don't mean to paint it as like, it's just sitting in a car. It's a cool thing I've gotten to do. And as a cycling fan, it's really cool. There's a lot that I could leave though.
One of the most surprising things I learned during this Tour de France cycle is that Primož Roglič goes out and runs every morning, early in the morning. So I'm curious if you've ever run into him, but I'm also wondering, are there any other things that people might not be aware of that are happening that elite athletes do at a race like the Tour?
Oh, I think there's probably a lot that they're not aware of. We've had one guy who likes to run on some days before stages. I've not seen, one guy in 13 years. So that's not frequent, but it does happen. There's a lot who like to get out and just go for a walk. The team, our team for years, the guys would finish, they'd get up, all go for a walk together, come back and play Uno at night. Like that was the thing. So there's a lot of camaraderie in that way. We've had a number of athletes who get up early and they will go for a walk, and I'll be out on a run and I'll see them just sitting somewhere doing their meditation. Like, sometimes in a field under a tree or just on a city bench, like just sitting there, cup of coffee. And, that's been a little less frequent in COVID because we got to stay at the hotel and whatever. But I think there's a lot that goes on outside that is normal human stuff. Don't get me wrong, but I think the mentality or the idea is that they're fairly robotic. They come back and everything's just boom, boom, boom. It's massage, it's recovery, it's Normatec, it's eating this many, it's weighing their grams of carbohydrates and eating exactly this many at this time. And it's not that at all. It's much more fraternal, I think.
Have the riders taught you anything about how to relax?
Oh yeah. I mean, they've taught me so much about so many things over 13 years. Absolutely. And we share a lot of things, book ideas and shows they're watching, or but there's a lot of back and forth about podcasts they're listening to that we'll share and then talk about. So a writer will be like, yeah, I'm actually reading this book, and I'll download it and listen to it. We'll talk about it on the bus. So things like that, but also there's in talking to a lot of them about how they approach pressure or how they approach performance and expectation and all those things. It's been fascinating to me through the years just to hear how they each do it, and to even, I mean, I'm definitely old now, to see the generational change in that, right? So when I started, the first race I did was Dave Miller and Christian Vandevelde, and I think Dave Zabriskie was there. And, to see how those guys handled certain situations versus now, same situations arise, but, a different generation of riders, and things that aren't necessarily right or wrong, just different. And it's been fun to watch, I think.
What are some of those things?
One that pops to mind, that I can say was a very obvious generational change was, with like Taylor Phinney and his generation, Taylor and Alex Howes and some of those guys, when there were numerous times where they would have like an ache or a pain, a knee hurt a little bit. And I was like, oh, well, let's get you a couple Tylenol or an Advil. And I was like, nope, no medication. It's like, whoa, really? It's like, yeah, we can do ice, we can do stretching, but I don't want to take anything for it. Versus an older generation that came through a time that was much more medicalized, to say nothing of the other stuff that was done, which is a legitimate and long conversation. But there was just a very different mentality that, anything you were feeling, there was a medication for it, right? You could take something to help with altitude. You could take something to help if your stomach was a little unsettled, as opposed to maybe having some crystallized ginger or drinking some sparkling water or something like that. And so what tended to happen, and I don't know that it was unique to cycling, I really think it was just a generational thing to some degree, is that you had this group that had a very medical outlook on things. And then you had one that had maybe a more, call it holistic outlook, probably to some degree in rebellion against what had happened before them in the sport. Some of it, quite honestly, done to them by doctors. Not that they were just innocent, but there were a lot of bad players in the team doctor realm too that would give them stuff without telling them what it was. Now, should they have taken it? There's a whole nother conversation, but there was a weird dynamic there. And so I think some of that was a bit of a rebound effect that, nope, I don't need a Tylenol. I just need, if you could go get me some ice and a compression wrap, that'd be great.
And you mentioned this continuum of how different riders manage pressure and expectations. Can you say more about that? What have you seen?
Yeah, without getting into specifics, I've definitely seen riders who manage that with more with substances, so drinking, and not always to excess, and not usually to excess, occasionally to excess, but I think again it's very similar to a cross section of the general population, but riders who again kind of self-medicate, right, with nothing that was banned or anything like that, but and then moving into like more of a focus on meditation and sleep hygiene and things that are maybe softer, probably more effective, in just a generational way. And I don't mean to say that like we had a team of drunks. It wasn't that at all. It was more like you got to know someone and know that, okay, in their time away from a race, they're blowing all steam a little differently than what we see now, where it's more frequent for guys to go home and not necessarily, their diet doesn't fall away, their sleep habits don't fall away. They pay attention to those things. So it's different. You can argue better or worse, but you can also look back and say, hey, the performances still were pretty good of those guys who blew off steam by maybe partying a little more. And so there's probably something to the benefit of that, the social aspect and everything else. I don't mean to paint it in black and white that way, just a very different thing.
Yeah, it seems that one of the things that people who haven't had that front row seat to high performance, or maybe haven't been around professional athletes, actors, entertainers, politicians, something that people don't always understand is that people who have the gift to do a thing don't always have the gift to manage the pressure that comes with doing the thing. At least that's something that I've observed in 25 years of having a front row seat. I don't know if that's jives with what you've experienced.
I think it's 100% accurate. They're not mutually exclusive. The ones that you see really flourish, I think, are the ones that have both. And it's almost analogous to like taking an athlete, putting them in a performance lab and testing them. And you see somebody who's got this massive VO2 and this lactate threshold that's just right up next to their VO2. They can ride all day. It's super fast. But if they have no tactical sense on a bike, they're not going to win much. They may win some time trials, but like they're not going to be a name you remember, right? So it's really about having a well-rounded mentality as much as a well-rounded physiology. So yeah, I think you're dead on, and it's probably more common than not that people don't tick all those boxes. I mean, who would, right? But when somebody does, or when somebody ticks a bunch of them, those are the names that you remember for a lifetime.
13 years into working with world tour level athletes, do you continue to learn lessons that you integrate in just to your own life as a human being?
Yeah, for sure. Without a doubt. I mean, even little things that there was an incident this year where, there was something I screwed up that cost an athlete some time. Right. And that, you work at it long enough, then something goes wrong, and going up to that athlete afterwards and just him being like, man, it's no big deal. Things happen. Right. And so that to me was really, it was really impactful. And it's also just a good reminder that what we're out there doing, it's important, but at the end of the day, we all think who we are and what we're doing is more important than it really is. And those people that help you remember to just keep it all in perspective, like not saying don't try hard and, don't do it better next time, but like keep it in perspective. That's always a good lesson. So yeah, even little things I'd say like that are good reminders when working with good people.
And Kevin, as you think about what's ahead, and you mentioned that the athletes you work with who continue to have that front sight focus, continually have a goal, and then develop a system to move towards it, tend to be the most successful. As you think about what's ahead for you, what do you want to do as you continue to grow and learn?
Yeah, I mean, I definitely have, I have a handful of goals that I have, I'm very solidly moving towards. Some of them are I can't say here because it's a career departure in some ways, or it's working with corporations or whatever. But overarching, it's really this idea that I want to every year advance in what I do, in what I know, and recognize that where I sit now, I've got a pretty unique expertise, and in a very small niche, it's my expertise is somewhat towards the top globally. That's not to say it's massively important or anything, but I mean, it's very narrow and there's so many things I can't do. But I never want to lose sight of the fact that like I want that bar to constantly move up for me, not for anybody else. I mean, I'm at a point where I don't care too much about externally what people think of me. Not that I'm a sociopath or an asshole, but it's like, I get much more, I gain much more just from the simple fact of learning and moving forward. And I think we can all become pretty stagnant. And even within my own practice, I can see where there's things we've done a certain way for a year or two. And I like to step back and say, okay, now why do we do it that way? How can we do it better? And that to me is a lot of fun to just kind of figure out what that constant progress is. And so I've got my practice and I've got kind of the steps and goals in moving it forward that are written down actually right out there. And then I've got some consulting roles that I do with companies on certain projects. And, those are kind of finite goals. We'll reach an end, a product will come from it or a stock sale or whatever. And so those are fun because they're finite. You finish something, you accomplish it, and you're done. And then there's personally the goals that I have, which are, I think, like I alluded to early on, they've become much more kind of personal and family related as opposed to performance related. Not that I don't think that I'll come back to that at some point, but just my fitness having been knocked down a good bit and slowly gathering it back, my focus in terms of accomplishment has gone elsewhere for a while, which I think has been really good. And though I'd love to have not ever had to go through this little health up and down, little roller coaster, I've gotten so much from it that it's really been a blessing, I think.
Has it shifted your perspective on any bigger picture things in life?
Oh God, yes. Yeah, without a doubt. All of them, I would say, from my role as a husband, my role as a father, even spiritually, like it's things that I just didn't really. Now, I was going to say things that I didn't really pay much attention to. I think I was a pretty good husband and father beforehand, but a lot of it was with a lot less intention. And now there's much more of the thought process behind that. Atrial fibrillation is not something that will kill people typically. It wasn't something where I had a brush with death or anything like that. But still, like going into my ablation procedure, which I had done, which is minimally invasive and a minor procedure, more or less. But
it's heart surgery.
They go in, they're going through walls of the heart and they're burning stuff. I sat down and wrote a letter to each of my kids. Like, there's a 1 in whatever chance that I don't come out of this, right? Something goes wrong. I don't think it's going to happen, but should it happen, there are things I want them to know that maybe I haven't said yet, or that I've said that I want to make sure they remember. And going through that exercise, that process was a difficult but really fantastic thing, I think, and very, I guess, indicative of the whole process of where a health scare like that takes you. From very focused on, okay, I got to get to work at this time, got to get my workout in, I got to do this and this, and pick up the kids, and we're going to do this. Like every goal is just kind of that next step, like just putting out fires to stepping back and seeing the big picture. And for me, that's been it's been enlightening, but also a lot of fun, really.
And how has that big picture shifted? Is it just, as you said, reprioritizing these things? Is there anything specific for you?
It's reprioritizing. It is a real recognition of kind of what's permanent and what's not, or not much of it's permanent, but what's long lasting and what's not. and also just kind of the individual insignificance, right? Like, at the end of the day, if something, in that procedure, if I didn't make it out of it, right, there aren't many people who are going to talk about me for very long after that, right? And I don't mean that as a depressing thing. I think it's actually kind of a nice thing. I mean, certainly it'd be tragic for my family, and you kind of step back and you say, okay, well, if you were to think that way, those for whom it would be tragic, like that's kind of who you need to be spending your time with, right? Like our legacy as individuals, we all like to think we're going to do something huge, it's going to change the world, and we're going to be read about in history books. And that's probably not going to happen for most of us, right? And so then it's really figuring out where is the best use of your time, because that time is limited. We don't know when it's over. And there's so many regrets of people who, when they're on their deathbed, when you're faced with the fact that that's coming for all of us, and all of us have that realization at some point, but when you're faced with it, I think it's a unique experience, or a unique chance to redirect a bit and just place importance and priority on where you spend your energies. So even though, like, in my head, the processing has been radically different, I don't think it's changed. Like, outwardly, it's probably not been a huge change, except that there are things that I will now blow off because my priority is to go, be with my family or do this and that, or even, blow off because, hey, I'm working on this at work, and this is something I'm really excited about and dedicated toward. And yes, I might have the 30 minutes in my calendar to do X, Y, and Z, but it's not going to be productive. And I really want to hone in on what's going to be productive. Let's do that.
Has your ability to access presence shifted as well?
Intermittently, yes. I would like to say yes across the board. I think my recognition of it has changed dramatically. And that's a big step. I'm not someone who meditates. I have always taken exercise to be my meditation. Going for a long, quiet run on a Saturday morning for me is totally therapeutic mentally. So I don't sit down and like turn on an app and do anything like that. But I would say previously, I was always in a headspace that was 15 minutes to 2 hours ahead, right? And now there's much less of that. I still get there, but I recognize it and generally am able to rein it back in.
That makes sense. It's very difficult not to time travel.
It is. And I think there's value in it. It's important to have some forethought and also some time spent kind of looking backwards and processing things. And we should do those things. If you're always present, I think that's probably an issue also. But I think the problem that most of us have is that we're rarely present. Kind of goes back to that exercise thing. Can you exercise too much? Yeah, probably. And we can parse that argument, whatever. But for the vast majority of us, it's not even worth considering, because what we need to do is get off our butts and exercise. And so what we need to do is get out of our way a little bit and be present. And that goes a long way.
So Kevin, to time travel to the moment when people will watch or listen to this episode, if they would like to find out more about you and what you're up to, where should they go?
So we've got a podcast called The Podium out of my practice, which is called Podium Sports Medicine. And that'd be a good place to find me. Our website is podiumsportsmed.com. And I'm on Instagram as well, intermittently. I'm not a big social media guy by any stretch, but I've got a little bit of a presence there, and we post stuff about the podcast and all there. So that's probably the best spot.
The podcast is excellent. I will add that link in the show notes. So everybody, please go check that out. And Kevin, thanks so much for your time today. I've really enjoyed this conversation, and it's great to get to chat with you at length, a bit longer than we typically get to do.
Well, likewise. Thanks for having me. I enjoyed it.
Thank you. This is Andrew Vance. I just want to say thanks for listening to Choose the Hard Way. If you enjoyed this episode, please subscribe, hit 5 stars wherever you listen, and leave a positive review for the show. You can also follow me on LinkedIn. I'm Andrew Vance, and I'd really appreciate it if you could repost this episode when it goes live on LinkedIn. Go to choosethehardway.com to sign up for the newsletter and share this episode with a friend who likes hearing stories about doing hard things.